Are you depressed and you do not know the reason behind it? Well, it can be due to vitamin D deficiency. Depression is a complex mental health disorder affecting millions of people worldwide. While various factors contribute to its development, emerging research has shed light on the role of vitamin D in mental well-being. Vitamin D, often referred to as the sunshine vitamin, is not just essential for bone health, but also plays a critical role in maintaining emotional and psychological balance. In this article, we will explore the link between depression and vitamin D deficiency, the potential mechanisms behind this connection, and how to address this issue to improve mental health. Understanding vitamin D and its functions. Vitamin D is a fat-soluble vitamin primarily produced in the skin when exposed to sunlight. It also comes from certain dietary sources, such as fortified foods, fatty fish, egg yolks, and dairy products. Once synthesized or consumed, vitamin D undergoes a series of metabolic processes in the liver and kidneys, ultimately converting into its active form, calcitriol. The vitamin plays a vital role in several physiological processes, including bone health. Vitamin D helps in calcium absorption, promoting strong and healthy bones. Immune system support. It aids in modulating the immune system, supporting defense against infections and diseases. Hormonal regulation. Vitamin D influences the production and release of hormones throughout the body, impacting various bodily functions. Neurotransmitter synthesis. It is involved in the production of neurotransmitters such as serotonin and dopamine, which are closely linked to mood regulation. The vitamin D depression connection. Over the past few decades, numerous studies have explored the potential link between vitamin D deficiency and depression. While the exact mechanisms are not yet fully understood, several hypotheses provide insight into their association. Serotonin production. Serotonin, often referred to as the happy hormone, plays a crucial role in regulating mood and emotions. Vitamin D appears to influence the synthesis of serotonin in the brain, and a deficiency may lead to imbalances, potentially contributing to depressive symptoms. Neuroinflammation. Vitamin D deficiency has been associated with increased levels of pro-inflammatory markers in the body. Chronic inflammation has been linked to depression, suggesting that insufficient vitamin D levels could exacerbate neuroinflammation and contribute to the development of depressive symptoms. Neuroplasticity. Vitamin D is involved in promoting neuroplasticity, the brain's ability to form and reorganize synaptic connections. Neuroplasticity is essential for learning, memory, and adaptability. A deficiency of vitamin D might impair these processes, impacting an individual's resilience to stress and life challenges. Seasonal affective disorder. Sad seasonal changes can significantly impact an individual's mood, leading to a condition known as seasonal affective disorder, SAD. Reduced sunlight exposure during colder months can lead to vitamin D deficiency and exacerbate depressive symptoms in susceptible individuals. Addressing vitamin D deficiency-related depression. If you suspect that your depression may be related to vitamin D deficiency, it is essential to seek medical advice and get your vitamin D levels checked. A simple blood test can determine if you have inadequate vitamin D levels. If diagnosed with vitamin D deficiency, here are some steps you can take to address the issue. Sunlight exposure. Spend time outdoors in the sunlight, especially during morning hours when the sun's rays are less intense. However, be mindful of wearing sunscreen and protective clothing to avoid harmful UV radiation. Dietary sources. Include vitamin D-rich foods in your diet, such as fatty fish, salmon, mackerel, tuna, egg yolks, fortified dairy products, and fortified cereals. Supplements. Your healthcare provider may recommend vitamin D supplements to help raise your levels to the optimal range. Always follow your doctor's instructions and avoid self-prescribing high doses of vitamin D, as excessive intake can lead to toxicity. Lifestyle changes. Engage in regular physical activity, maintain a balanced diet, and manage stress through mindfulness practices or therapy.